Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. I shall be talking on the topic comorbidity and early death. When we say comorbidity, it is like trying to define that somebody has a condition, a disease, and then in the process again, there is another condition, another disease abiding in the same person. So it could be even be more than 1, 2, or 3. And these kind of diseases are not causal to themselves, that it has not been proven. Because, for example, a person who has diabetes are usually having high blood pressure. You want to now believe that that high blood pressure that condition, that disease could be the cause of diabetes or the other way around. But that has never been proven. The causal relationship has never been proven. But what has been proven so far is that when there is comorbidity, there is a kind of reduced lifespan. So when compared with people who probably don't have these conditions or don't have comorbidity. So this comparison I shall expose and in the slide section, and you will be able to know more. There are other information that comorbidity could affect in our life. We know of infection. Infection could have so many relations, like a situation where you have worm infection and you have different types of worm infestation in the same person. But how does that correlate with comorbidity? I will talk a little about that even in the slide session. We also would want to know the role that the medical laboratory play in the diagnosis of comorbidity. So let's go on into the slide section and experience more knowledge. The outline: objective introduction, comorbidity, mortality, lab diagnosis, and recommendations are all I shall be speaking on. The objective: to create the necessary awareness of comorbidity, mortality rate, and how early medical laboratory diagnosis could assist in reducing early death from comorbidity. Introduction. Morbidity is the state of being diseased when one is unhealthy, is counted amongst those the population of the morbidity rate. It is distinct from mortality or mortality rate, which refers to death, those who are dead from the same infection or condition of disease. Morbidity can be qualified in terms of incidence and prevalence within a given population. So, comorbidity is the occurrence of a secondary medical condition in a patient who already has a primary index disease. As the world is aging, chronic diseases are taking central stage, and so more incidences of comorbidities are being recorded, compounding cost of treatment. If there was an established causal relationship, then prophylaxis will stem the tide of comorbidity. The morbidity rate is usually higher than mortality rate because you will first of all be sick or you encounter the disease before it starts killing anybody. So the number of people infected or who are affected by that condition would normally be higher than the number of people dead because some people are surviving. It therefore goes without much effort that a compounded disease will surely cause early death, as witnessed in some studies here. A recent study of more than 1.3 million individuals showed that nearly 98% of people living with type 2 diabetes are also dealing with at least one comorbid condition or chronic disease. For example, obesity. There is evidence that About 90% of people with type 2 diabetes are also facing obesity. Carrying a lot of weight can increase a person's insulin resistance and negative impact. The beta cells of the pancreas will be affected. Dyslipidemia, that is, according to a cross-sectional study published in 2021, about 32% of individuals with type 2 diabetes also had issues with their lipid. High cholesterol occurs as a result of increased level of low-density lipoprotein, the one we call bad cholesterol, or low level of high-density lipoprotein that we call good cholesterol, and these are issues that continue. Yeah, we are talking of diabetes comorbidity there, where diabetes is the primary disease or the condition. 3, hypertension. According to American Diabetes Association, 2 out of 3 people living with diabetes will report having high blood pressure. Then 4, cardiovascular diseases. Also, it's linked to both diabetes and hypertension because an elevation in blood sugar can damage blood vessels and even lead to hardened arteries, and it can eventually cause damage to the heart. The Center of Disease Control and Prevention, CDC, points out that a person with type 2 diabetes is more likely to suffer heart failure, a condition that you normally witness the feet swelling, the leg swelling, fluid in the lung, and difficulty breathing. The kidney is another comorbidity with diabetes. The high blood pressure associated with type 2 diabetes can damage the kidney. That is where you now have another comorbidity. According to the National Kidney Foundation, type 2 diabetes is the cause of kidney failure in the United States. 6, metabolic dysfunction associated liver diseases. That's when you have fat accumulation resulting in high liver enzymes. 7, according to CDC, people with diabetes are 2 to 3 times more likely to develop depression than those without that's when you are talking of the mental health of people, that even diabetes comorbidity extends to the mental health, and you can imagine the sufferance. And it's just because they don't keep to the street treatment that will keep them alive for a very long time. Comorbidity mortality. When you talk about the mortality, that is early death, that is those who are dying from comorbidity. Comorbidity is not a category of disease, agreed, just like co-infection is not, but their impact on overall health, decreasing patient quality of life, complicating diagnosis and complicating treatment choices, and increasing mortality are why they should be of primary health concern, so that the people who attend clinics would not only be treated for just one condition, but they should look for other underlying condition that probably caused it or is not very obvious. In the cardiovascular health study, which followed more than 5,200 adults for over 30 years, 16% were frailer than expected based on their comorbidity. So let's examine more research here. Yeah, let us change this scenario to where cancer is now the index, the primary cause. Comorbidity amplifies mortality risk by about 6-fold in cancer patients. Studies on breast cancer have found worse survival rate for patients with comorbidity measured by Charlson Comorbidity Index compared to those without, according to MSEGA. COVID-19 too is another study that shows a link between advanced age, comorbidity, and increased mortality, as well as there is also the perioperative mortality. One study found a significant higher 28-day perioperative mortality rate in patients with comorbidity compared to those without report. So the reports are so many, but I cannot cover all. Now to laboratory diagnosis. From all the exposition in this video so far, Type 2 diabetes seems to have multi comorbidity than any other primary cause or index cause of any of these conditions. So, and as such, the early diagnosis of type 2 diabetes for effective management should save those people suffering from this condition, comorbidity. So one could easily agree that majority of people who die early from diabetes are people who have comorbidity. The usual samples are blood and urine to perform fasting blood sugar, glucose, random glucose, HbA, kidney function tests, liver function tests, non-function tests, and many screening tests to rule out any onset of this problem. Finally, the recommendations. People are now living longer because the majority of communicable diseases have been demystified and treated early enough, creating immunity against them. But we are now faced with non-communicable diseases as we grow in age that requires early detection for the necessary intervention that will halt their progress to the fatality stage. For example, all those who have adhered to strict compliance to type 2 diabetes treatment, they don't suffer the complications of comorbidity that is usually experienced, and they live longer than the non-compliant patients. The advice is strict compliance once an early diagnosis is done, regardless of whether it's cancer, whether it's diabetes, whether it's even psychiatric problems that has so many comorbidity. So if you like my presentation or enjoyed my video, please watch more and make sure you subscribe. Invite more people and press the like button for more of encouragement to produce more of this type of video. Thanks for watching.